Hi, I'm Naturopathic Dr. Samia McCully, and today I want to talk to you about anxiety. I work in a building with 16 psychologists, and most of them specialize in treating anxiety. I also have many patients who come to me with the complaint of anxiety. Something that's important to know is that anxiety is largely a function of blood sugar control, or poor blood sugar control, I should say. So what you probably don't know is that anxiety has a lot to do with a neurotransmitter called GABA. GABA is made in the brain, and it's made with sugar. When we get really low blood sugar, anxiety and low blood sugar seem to come hand in hand. In fact, if you look up the symptoms of hypoglycemia and a panic attack, you'll have almost identical symptoms. And so what does GABA do? Well, GABA acts in our brain kind of like a switch. It's a dimmer switch. And so it shuts off the amount of stimuli that can reach us and can kind of irritate us. If we're feeling overly stimulated by things, we're going to feel anxious and we're not going to feel good. So when our blood sugar is low and we can't make enough GABA, we tend to get more anxiety. So if we have more control over our blood sugar, by eating at the right times, by eating the right things, then a lot of the anxiety that most people have can be alleviated without any talk therapy at all. And while I do think that talk therapy has a very important place, I think sometimes we're missing the boat, and diet changes will have a bigger impact in the long run than talking about something that may not actually be a problem. It's just that your brain can't shut off to the spinning that it's in. So one of the suggestions I give to my patients is to eat their lunch a little earlier, like around 10:30 or 11 o'clock in the morning. You can avoid that energy dip that you get in the afternoon, which is an indication of low blood sugar. Another symptom that you may have if anxiety is associated with your blood sugar is that you have difficulty staying asleep. What happens is in the middle of the night, if your blood sugar drops too low, your body sends out alarm signals because your body always wants to be in homeostasis. So it will spit out epinephrine or adrenaline, and the epinephrine will make you wide awake. Most of the time you don't feel hungry, but if you have a snack in the middle of the night, when you wake up, you'll fall back to sleep within a few minutes. And so when you have that epinephrine being spit out, it's very difficult to fall back asleep. So the body wants to raise the blood sugar and it just can't. So the blood sugar being impacted is an effect of what we've eaten for the rest of the day and what times we've eaten. Another suggestion I give to people is to add more fat. If those don't work for you and you have more questions, you're always welcome to schedule a free 15-minute phone consultation to see if naturopathic medicine is the right route for you. Again, I'm Naturopathic Dr. Samia McCully. Important information to know, I think, and have a great day.